The 7 signs of diabetes severity. When should you seek emergency care? When should you consider? Now I can wait no longer. I must seek help. At this moment, it's an emergency. On that note, I brought my colleague Junior, a nurse specializing in emergencies. We worked together for a few years. He will assist me in this video, bringing the nursing perspective as well. Not only from the medical, but the nursing viewpoint. Joao, great to be here, to see my good old friend, hoping we can continue working together for many years in urgent and emergency care, serving many patients, saving lives together. Likewise, Joao, a pleasure, Master. Great to have you on board. Let's get to the signs then. What should the viewers worry about? The first sign to discuss is change in breath. If you have diabetes or even undiagnosed, the breath change, known as ketonic breath, it signals diabetes. Not just diabetes, but a complication of diabetes, known as diabetic ketoacidosis, when the diabetic can no longer produce insulin due to an autoimmune attack on the pancreas's beta cells, which produce insulin, and your blood sugar starts to skyrocket. At this time, the diabetic starts producing ketone bodies. Unable to use sugar for energy, it triggers another metabolic pathway, starting ketone production, altering the breath. For everyone's understanding, to break it down, regarding breath changes, it alters the scent. And if you experience this, it's a significant sign that may require testing to rule out diabetes. Louise in the ER, have you noticed this change in breath in many cases of diabetic ketoacidosis? What can you share from your experience?
This is noticeable, Joao. During patient triage in the emergency department, we often detect ketonic breath. This immediately raises concern as it points to a severe condition. It indicates that the patient is experiencing diabetes decompensation. So we'll check their blood glucose, HGC, hemoglyco test, and look for any other anomalies. Another common sign is deep and slow breathing, known as Kussmaul breathing. Upon noticing, we must immediately refer these patients to an emergency room for laboratory testing and diagnosis.
Speaking of HGT, some places employ a glucometer for this test. It may also be universally known as capillary glycemia. How familiar are you with the glucometer test? Since we're reaching out to different parts of the world, we have small differences, but it's the small device that pricks the finger, delivering quick results. Extremely useful in emergency situations. This glucometer will display HI on the sensor if your blood glucose level is higher than 600. You should seek hospital care in such a case. Blood sugar levels above 600 should not be ignored until your next doctor's appointment. A glucose level over 600 indicates a serious condition, potentially triggering additional symptoms we'll discuss here. Junior, is HI common in ER settings? Does it occur frequently?
Especially during screening, when we screen up to 300 or 400 patients daily. A patient with hyperglycemia is usually taken to the red room or emergency room for investigation. Hyperglycemia is prevalent in urgent and emergency services. This is quite common.
Blood sugar levels can sporadically rise significantly. This may exceed 600, often due to an infection or new medication. Corticosteroids, stress, academic tests, or personal issues could be triggers. If you're diabetic, you're aware of this. What happens to blood sugar during stressful periods? It rises. Sounds familiar? Why does it happen? Stress naturally prompts the increase in adrenaline and cortisol. Other hormones also elevate. These hormones naturally raise your blood sugar because during stress, your body needs to stay alert. A higher blood sugar level grants you more energy. However, for a diabetic, this could trigger a crisis, causing a swift spike. So, the secondary sign is this fluctuation in the capillary blood glucose test. When it indicates HI on the screen, that's too much. I want this video's information to be clear. As often, when a patient comes in with a severe condition, they could be unconscious and showing various other signs. So the blood glucose was already over 600 and the patient ended up. Many people don't know what HI means. They just note it down, assuming it's a test error. No, it's when it's extremely high, and even if you don't feel any symptoms, you have to seek immediate treatment. You can't just wait for a routine appointment. You can't afford to say, oh, I'll wait till my next endocrinologist visit in 2-3 months. No. You shouldn't do that. You need to act swiftly. As with our third warning sign, I'm listing 2 here, which are excessive thirst and frequent urination. When the blood sugar level spikes, to compensate, the kidneys naturally try to get rid of sugar through urine. The kidneys excrete glucose in urine, which makes you feel very thirsty. Glucose, the sugar molecule, plays a role here too. It affects water levels, and generally, when diabetics arrive in the ER with these signs, they are also dehydrated. The patient is drinking water, and yet they're dehydrated, showing a water deficiency in his body. This is because the kidneys, in their attempt to protect us, end up eliminating sugar, triggering a defense mechanism. But if you're overly thirsty, consuming several liters a day, and it's a change from your normal pattern, for instance, you've increased water intake threefold, that's a sign we need to investigate for diabetes urgently, not just a routine check. If you find yourself overly thirsty, passing more urine, you should head to the ER, as we can promptly determine if it is a diabetic emergency or not. Is the sign of frequent urination and excessive thirst common in patients who present with high glucose levels?
Yes, it's quite common, Joao. They always come through the door, either at triage or directly through the emergency entrance, self-admitted or even by EMS and firefighter assistance. During our initial interview at triage, we ask about the symptoms. Typically, they report excessive thirst and frequent urination, or increased urination during the night might occur right away.
Our initial step involves the HGT or dextro test we've previously discussed. Afterwards, the patient will be examined by the physician on duty or in the emergency room, or they might seek an evaluation from an endocrinologist or relevant specialist. Number 4, the fourth critical symptom, one I always stress from the first consultation. It's concerning changes in vision, blurred sight or bright flashes, also shadows. Changes in vision indicate an emergency. You mustn't wait. It could indicate a condition called retinal detachment, more prevalent in diabetics. Due to high blood sugar, it damages the visual system, thus the vision change. We should also assess the glucose level, the metabolism. The blood sugar, raised sugar levels could cause irreversible damage, so it's indeed very serious. Any alteration in vision necessitates an emergency visit for diagnosis. Routine appointments can't be waited for. What about in practice, Junior? This complaint is very frequent, especially during screening. Patients report blurred or fuzzy vision. So during the investigation, it's noticed that the patient has extremely high blood sugar levels. This leads to various complications.
One part of the emergency is blurred vision. It may also be accompanied by shadows or flashes. There's another complication too. That's when the patient has elevated blood sugar levels, not necessarily high enough for an emergency visit, but they also have damage to the retina. This is a chronic complication called diabetic retinopathy. That's why type 2 diabetics should, at diagnosis, be referred for an evaluation with an ophthalmologist. And what if you are a type 1 diabetic 5 years after diagnosis?
Because in that exam, it's possible to detect secondary changes, increase in blood sugar, even before you show symptoms.
And number 5, the fifth emergency, the fifth sign, that you should seek hospital care. I want to bring attention to the other side. We're talking about high blood sugar, but hypoglycemia is also a complication, often fatal and not often discussed. Why? It's much less frightening.
I understand that.
Think about it. We were talking about blood sugar levels over 600 when the patient has hypoglycemia. What's normal? What is hypoglycemia?
Levels lower than 70.
So if their blood sugar level is 55, they think, wow, 70 is a good value. I'm 55. From 55 to 70, this shouldn't have a profound impact, which is entirely incorrect. Why? Currently, hypoglycemia in its acute phase is as worrisome as extremely high hyperglycemia, even with higher complication rates. Why? What are the symptoms of hypoglycemia? Tremors, cold sweats, palpitations. The patient feels as if their heart is beating out of their chest. Mental confusion, difficulty thinking. Severe cases might even have seizures or go into a coma. So when your blood sugar is low, you must pay attention too. If the patient becomes unconscious, they must be taken to the emergency room immediately. Family members should take the patient to the emergency department for evaluation and better treatment of hypoglycemia. Hypoglycemia is a common complication, particularly in emergency situations.
How's the scenario when patients come in with hypoglycemia? Do people take this seriously? Do you notice that people often underestimate its severity?
Joao, these patients are indeed frequently admitted to the emergency department.
How so?
Often they are unresponsive, unable to communicate with us. So initially these symptoms might be confused with suspected stroke or even neurological disorders. Then all of the patient's vital signs are checked, including blood pressure, heart rate, respiratory rate, and temperature. After that, nursing professionals perform HGT tests, detect verifying if the patient has hypoglycemia, say a value of 32. With this value, the patient would be unconscious, unable to communicate. Emergencies happen frequently. Patients often report intermittent fasting or wild diets, or self-medicating in fact. This is very common in urgent and emergency services. Many times the patient might arrive in a coma, having fainted, leading us to gather information from relatives.
Dieting is an important topic to touch upon, like the ketogenic diet, which is not recommended for those with type 1 or 2 diabetes using insulin or medication to stimulate insulin production. People with type 1 diabetes can't follow this diet. You'd avoid all carbs. This for type 1 diabetics is harmful and can lead to decompensation. I've seen 2 cases already where patients decompensated due to diet while working in the emergency room. They thought it was beneficial. The patient found it online, someone recommended, but he used insulin and had type 1 diabetes. This resulted in harm, making it an emergency. Emergency care was needed for recovery. It's crucial to consult a nutritionist or doctor before starting any diet to ensure it's safe for you. Intermittent fasting is another diet. Depending on the fasting type, it can affect diabetes. The impact depends on the medication taken and the type of diabetes. Just because one person follows it doesn't mean it's good for you. And the 6th sign I want to address is weight loss. But it's not any weight loss. Rapid weight loss, despite not dieting, no change in routines, no exercise, no justifiable change in weight. Usually this change is more than 10% of the weight. If you're 100 kg, for example, and now you're 90 kg, that's a significant drop for no apparent reason. This change also needs emergency investigation. Diabetics often lose weight quickly because insulin can't process the sugar in the blood and put it into cells and muscles. This applies to both type 1 and 2 diabetes. With type 1, symptoms appear faster. When blood sugar rises, our body can't respond. Insulin can't react as it should due to insulin resistance. This also happens with type 2 diabetes. Weight loss can be a serious issue, often preceding severe conditions in diabetes, leading to high mortality rates. You shouldn't wait if you're losing weight without any cause. You realize you're losing weight? Seek help and have to wait until next month for an appointment. That's too long.
That delay might determine if you'll have serious diabetic complications or not. So if you're rapidly losing weight, go to the emergency room. Check if you have diabetes, because this worries me greatly. When someone eats a lot and is very hungry but still loses weight, take notice. So be attentive. Weight loss US, what's your experience with this type of patient in the ER?
Patients arrive repeatedly, always through screening. This type of patient complains of weight loss and extreme hunger. Often the patient arrives and says, I've been losing weight for 5-6 months and I'm always hungry. The patient doesn't know what's wrong. Then we complete a screening form gathering all vital signs of the patient.
Did you enjoy this video? Did you find it helpful? Then don't forget to like it and rate from 0 to 10. What mark do you give this video? If it's 10, we'll create more of the same. And I'll ask Junior to join us here more frequently. If you liked it, comment where you're watching this video from. Junior hails from Aragua do Sul in Santa Catarina. I'm reporting from Porto Alegre in Rio Grande do Sul. Comment below. I'm putting in a recommendation for you to watch. It's a video where I discuss the 11 best foods for diabetes. If you're diabetic, pay attention to your diet and be informed about your condition. These foods are excellent for diabetics. Click here. I'm sure you'll find it beneficial. Take care.